Welcome, everyone, and thank you for joining our NeuroWellness talk this evening. My name is Catherine Kiefer, and I am the Neuroscience Program Manager at Rush University Medical Center, as well as the co-founder and president of the Brain Health Center of the Rockies, and Patient Education Manager for Nira Medical. For those of you who are new to NeuroWellness talks, so it's nice to see new folks joining us. This is a webinar series that empowers patients and family members with practical strategies for brain and neurological health. Experts in neurology, rehabilitation, nutrition, exercise, and neurological health join us for these particular sessions. We share evidence-based approaches to living well with MS and other neurological conditions. The sessions connect scientific insight with everyday habits, helping participants make informed choices for long-term wellness. This particular session, since it is March, we are honoring MS and NMOSD Awareness Month. We wanted to dedicate this webinar highlighting the impactful work of leading patient-focused organizations dedicated to supporting individuals who are living with multiple sclerosis. We are fortunate to be joined by Dr. Parisa Khosravi. We're hoping she can join us this evening, as well as representatives from the Multiple Sclerosis Association of America, MSAA, Can Do MS, and the National MS Society, which will share insights into the outstanding resources, education, research initiatives, and community programs they provide. Tonight, we get to learn what each of these organizations have planned for 2026 and discover meaningful ways that you can get involved. As always with NeuroWellness talks, we intend for this to be an interactive program. So we do welcome you to use the chat box at the bottom of your screen to pose any questions that you might have. And we'll definitely pause and allow to answer any of those questions within this 1 hour time frame. To highlight our speakers for this evening, I will start off with Alexis Klein. She is the Associate Vice President of Mission Delivery for the Multiple Sclerosis Association of America. Many of you may know it as MSAA, where she has spent nearly 8 years advancing efforts that strengthen support, education, and care for the MS community. Alexis has a Master's of Public Health and is pursuing her doctoral degree focused on bridging the gap between real-world MS experience and barriers to equitable care. I love that, Alexis. It's wonderful. As the daughter of someone with MS, Alexis brings a deep personal commitment to her work and a profound respect for the resilience and experience of people living with MS, their care partners, and the clinicians and specialists who support them throughout their journey. Through her contributions, Alexis helps drive MSAA's mission to deliver innovative programs, resources, and advocacy that empower the MS community and improve lives across the country. We also are joined by Dr. Rosalind Kalb. She is with Can Do MS. She is a PhD clinical psychologist who has specialized in MS care and education for more than 40 years. That is severe dedication. She started her career at an MS Comprehensive Center in New York, then worked at the National MS Society for 16 years, and now serves as a lead senior programs consultant at Can Do MS. Roz has provided individual, group, and family psychotherapy, cognitive remediation, and wellness coaching for people living with MS and their care partners. She has also developed clinical guidelines for healthcare professionals and is a prolific author. I just learned that Roz most recently led as an author for the 3rd edition of Multiple Sclerosis for the Dummies, and a co-author of the 2nd edition of Navigating Life with Multiple Sclerosis, both of which were published in 2025. So be sure to check those out. Last but not least, we have 2 representatives from the National MS Society. Elisa Schweinberg. She is an experienced program manager with over 20 years of service in the nonprofit community. In her current role, she is the healthcare engagement manager for the National MS Society, where she leads the development and management of healthcare providers, relationships with implementing healthcare access work, including gaps in care, professional education, increasing referrals to the society, and partnering with community health organizations. I was thrilled to learn a little personal note about Elisa. She enjoys cooking, art exhibits, and surfing, which I think is really cool. And she is joined by her colleague, Margaret Sheridan, who is the Director of Community Events for the National MS Society, where she leads the execution of the community events fundraising campaigns in Colorado, Utah, Wyoming chapter. Since joining the Society in 2024, she has been building peer-to-peer fundraising efforts and support people affected by MS throughout the chapter. So honored to have all of you here with us this evening. Well, on that note, there's so much that we can cover this evening, and I want to make sure I turn it over to you folks so you can shed a little bit of light about what all you're doing. So, Alexis, if I can maybe have you start us off and speak a little bit about what all is taking place at MSAA.
Thank you so much. Sorry, it took me a minute to find my mute button. So it is so nice to be here tonight. And like Kathy mentioned, my name is Alexis Klein, and I'm the Associate Vice President of Mission Delivery with the Multiple Sclerosis Association of America. I just wanted to quickly say I'm honored and thrilled to be here tonight, even to just spend a little bit of time with everybody, all of you, especially in celebration of MS Awareness Month, and also a thank you to Kathy and the Neuro medical team for having us tonight. This is really wonderful. So without further ado, if it's our first time meeting, or it's been a little while since you've connected with MSAA, we were founded in 1970. And so now for more than 50 years, we've been co-learning, knowledge sharing, and collaborating with people living with MS, care clinicians, and innovators to make sure that we're working towards a world where people living with MS have access to equitable care and trusted resources that can strengthen the community. Our mission is for MSAA to be the leading resource for the entire MS community, improving lives today by delivering vital services and compassionate support, while advancing access, research, innovation, and strengthening the community for tomorrow. And our vision is to create a world where people with MS and their families have equitable access to care, trusted resources, and the dignity and respect they deserve so that they can live well and meaningful, full lives. So now I'll talk about some of the ways that we try to do that. So this slide is just a really big overview of all the things, or some of the things that we do at MSAA. So we have a toll-free helpline, we have a cooling equipment program, we have an MRI access program, we offer health literacy and health education activities, as well as shared management and publications and online resources. This is just some of the things that we do, though. So the first thing I like to share about is our client services helpline. When you call MSAA, these are the first folks that you're going to talk to. They have a background in social worker counseling. They're familiar with MS. They can share information or details about MSAA's programs and services and what we have available, but they can also help network and find resources that are near you. They are also just a kind and loving ear to listen to if you need someone to talk to or support. So for MSAA's cooling and equipment and mobility program, we have a number of offerings through this for eligible individuals. So our cooling and durable medical equipments are best suited for those who are experiencing financial or insurance barriers to accessing some of those tangible things that can help address the symptoms of living with MS. For our cooling equipment program, there's a number of garments that you can order. They can be worn under or over the clothing, and they're really helpful for people who are experiencing heat sensitivity. We offer that program year-round, so you can apply anytime. We also have equipment and mobility tools that we offer for eligible individuals. And so those are going to be things like shower grab bars, utensil sets, bathtub transfer chairs, four-wheel walkers. And then we also have some neat additional things if you're interested that are really focused on wellness. So like a yoga mat, some yoga bands, and other things. MSA's MRI Access Program. So this is a really wonderful program for eligible individuals. We're the only organization, I believe, right now that offers it, and it's for people who are having trouble being able to access their clinician prescribed MRI to receive a diagnosis of MS or to track for monitoring. For individuals who are underinsured or underinsured or experiencing financial barriers, you can apply to the program. We can offer cranial or C-spine or both MRIs, and you'll get assigned to a center that's convenient for you, and MSAA will help cover the cost. There's also another way that you can participate, whereas if you want to go to a center of your choice, you can go there and then your billing will get submitted to MSAA, and we can cover up to the cost of $750 per MRI. And that program eligibility is every 2 years. I will definitely make a note to check back on this. We have a new innovation coming to this, which will be neat. You'll hear about it in the upcoming months, but I hope that you'll stay connected with us for that. Our health literacy and health education program. So MSAA has a number of ways that we like to share information and collaborate with clinicians and lived experience experts, people living with MS. So we have a huge network of in-person programs and webinars. So every month we host an online webinar. It's always on a different topic. We like to listen to our community and hear what people want to hear about. We also like to work with clinicians or just innovators who are interested in sharing. Just last month, we had a journaling webinar, which was really wonderful to spend time together and do that. Our in-person programs are always led by a champion in MS care. So that is somebody who has advanced training in multiple sclerosis and can really provide updates and share information about best practices. We have a number of topics that we focus on, and those change year round. And so if you happen to be in the Syracuse, New York area, I know this isn't the target area right now, but if you happen to be in Syracuse this Saturday, we'll have an in-person program and you can check us out online. And then we'll have a few more upcoming in Philadelphia and Arizona in the next couple months. We also offer some on-demand and on your own listening opportunities. So if you're interested in any of our webinars, if you're interested in listening to any of our podcasts, those are all available online. And we also have shared decision-making in our community connection tools. So these are just ways that we think that people can stay connected and stay informed online. So our first one there, a shared management tool I'd love to highlight, is our Ultimate MS Treatment Guide. This is a website that has all of the FDA-approved disease-modifying therapies for MS in one place. They're in these neat little clickable tablets. And so when you click on it, it has a short little video from an MS expert in care, as well as a quick note about what to know about that treatment, what it's good for, who it might be meant for, and the modes of administration. We really think that this is a neat way to stay communicating with their clinicians. If you're curious about what treatments are out there, you can take a look, print it out, and bring it with you when you go see your doctor. We have a number of online networks. So we have an MyMSAA community, which is a place that will go and post conversations. It's kind of like a Facebook for people living with MS and their care partners to help talk, ask questions, and learn from each other. We have a blog, which we have featured blog posters. We have people from the community as well as MSA staff and helpline folks who will contribute to that on a variety of different topics. One of my favorite things is our MSAA art showcase. If you have any artists out there and you want to share your art with us, or if you just like looking at art and reading about it, I would definitely encourage you to go there. The picture that's on my screen is a collage of our art showcase artists, just some of them from this past year. So it's really wonderful and neat. And if you're an artist, I hope that you'll send in some things for us next year. And then our publications and guides, we have a huge library of online publications, and most of them you can actually order and we'll send them to you at no cost. This is great for clinicians too. If you go to your doctor's office and you think that they should have some more information, some colorful or interactive, easy to read, friendly information about MS, we have tons of publications. And some of those also are accompanied by some interactive workbooks and tools online that you can also use. And the last thing that I'll just touch on quickly is our multiple sclerosis implementation network. This is a collaborative research study that was designed by MSAA in partnership with people living with MS, champions in MS care, implementation science researchers, and some industry partners. So right now, the MSIN has more than 20 neurologists participating and 1,000 people living with MS participating. And what's really neat about this is on our steering and oversight committee, we have 2 people living with MS and MSAA to make sure that the research that we do and how we share what we learn is really focused on what's important to the MS community, and that we're making sure that we're completing the feedback loop. Our most important information is coming from people living with MS, and we want to make sure that they stay connected and aware of how we're using it. So Oh, that. Thank you so much for having me. It was wonderful to share. And if you have any questions or need anything, you can reach out to MSAA with these general contacts, or I'm Alexis Klein, and please reach out to me anytime.
Fantastic, Alexis. This is really great, and I know there's been quite a bit of interest in the cooling program that MSAA has, as well as the MRI program. But I was not aware of the shared management tool, which I think is definitely really a great resource to allow patients to feel a little bit empowered as they're having those discussions with their neurologist. So thank you for sharing all of that. And I'm sure if anybody is interested in particular about any of the programs, they can just access your website and find how to go about accessing that. Lovely. Well, I see we have Dr. Parisa Khosravi here with us as well. So I'm going to pivot real quick and allow for Dr. Khosravi to speak with us as well. I do want to give a little bit of an intro about Dr. Khosravi. So for folks who do not know Dr. Khosravi, she sees patients at Central Texas Neurology Consultants, which abbreviated as CTNC, located in Round Rock, Texas, which is just north of Austin, Texas. She specializes in the treatment of multiple sclerosis and is dedicated to delivering care that supports each individual's unique journey with MS. As such, her clinical interests include multiple sclerosis, neuroimmunology, and addressing health disparities in MS, which I think is super important. So thank you, Dr. Khosravi, for that. He has been recognized with awards and honors, including National MS Society Clinical Care Physicians Fellowship Award, the I'm in Neurodisparity Award, Fellowship Award, the Learning Environment Award, and the Gold Humanism Honor Society member. In her free time, and I can very much relate to Dr. Khosravi on this one, she enjoys traveling, hiking in nature, and spending time with her husband and two kids. Dr. Khosravi, thank you so much for joining us this evening. And I was hoping to have you perhaps shed a little bit of light on how you go about discussing how patients can go about seeking support. So, as a neurologist, how do you approach those conversations with your patients?
Well, thank you for give me a second, sorry, because I have an echo. Thank you for the introduction. And thanks everyone for joining. Today I'd like to spend a few minutes discussing some of the resources that are available for people living with multiple sclerosis. My hope is that by the end of this talk, you will know where to look when you need information, and I will share with you what I share with my patients. So let's start with an example. Imagine a 32-year-old man. His life is finally going well. His career is growing. He's healthy. He's even thinking about getting engaged. He's always been healthy. He never really worried about things like health insurance. Then one day he suddenly has a vision problem. And a few days later, he's sitting in a neurology office and he hears the word, you have multiple sclerosis. Suddenly, everything feels uncertain. His health, his future, his job, how he's going to afford treatment, all these questions starts coming at once. And that's really the moment when good information, support, and the right resource becomes very important. So MS affects more than just the health, right? It affects work, it affects finances, mental health, daily life. And because of that, it brings a lot of uncertainty. From my personal experience, one thing I've learned, medication alone is not enough. Living well with MS also requires good information. It requires supportive communities and practical resources. So at the time of diagnosis, patients often hear different recommendations, sometimes from different doctors. And honestly, that can feel very confusing. Like many medical visits, the time of the doctor is limited. So patients don't always get a full explanation of why a specific treatment is recommended. Because of that, having reliable resources becomes very important. Resources that help patients learn about disease and treatment and also help them find community and support system. So I want to start and share with you one important thing that every patient needs to know, that there are many organizations around the world dedicated to support people living with MS. And one example is the Multiple Sclerosis International Federation, or MS. It's a global organization that connects MS societies from many countries to share knowledge, promote research, and improve access to care. And I want to bring to your attention the education part, as you see here. For example, we can start, let's say a patient gets the new diagnosis, start here. What is MS? Diagnosis of MS, treatment and therapies, and many other resources, for example, MS and menopause. Also, to find your community, find MS support, you can click here, find MS support, and you will find the MS community in your country. And one resource that I strongly encourage every patient with MS to explore is National Multiple Sclerosis Society website. It's a great source of information about the disease and living with MS. But if there is one thing I want patients to remember from this organization, is their MS Navigator program. And I tell every single patient, MS Navigators are trained professionals. You can connect them by chat, by email, by calling them. And they are there to help patients with practical questions, things like insurance, medication, employment, finding local resources. So they will find resources. They prepare, they have your case, and they try their best to help you. As you see in their website, when you log in, you can see resources for newly diagnosed MS, for MS symptoms, find doctors, resources, find events. And I'm sure we're going to have more detailed information here later. And thankfully, we already heard about MSAA, Multiple Sclerosis Association of America. I love this resource. It provides practical resources, educational program for people living with MS. And one resource I honestly recommend to all my patients when we come to decision about medication is the treatment part. Let me show you where we go on that website, if I can open it. So here, treatment, and if we go to disease-modifying therapy, reading about all the disease-modifying therapy, and then ultimate MS treatment, we can, for every FDA-approved disease-modifying therapy, there is a video that is very helpful. And I recommend all my patients, when I tell them what medication they can choose, to go on this resource and get information. And the other thing is their MRI access program that was already talked about. It's very helpful for patient who doesn't have insurance, their income is low, and they can help up to $750 for MRI, and it pays for MRI brain and neck or cervical. Another organization I like to mention is Multiple Sclerosis Foundation, also known as MS Focus. What I appreciate about this organization is that many of the resources are very practical and directly helpful to patients. They offer emergency and healthcare assistant grants, as you see here, emergency assistant grants, healthcare assistant grants. They have different type of grants. They also provide excellent educational resources. As you see here, it has educational material. There are downloadable PDF guides on many topics. And one of the PDF I tell most of my patients to download, because they go read about different diets and they want to know which diet helps, is this PDF source that has research about every different diets in MS, for example, Swank diet, Wall's protocol, and they can read about those diets and how they can help them. Another organization worth mentioning is the MS Coalition. It brings together several major MS organizations. Their goal is to share reliable and up-to-date information about MS. For example, here we see an article about a newer biomarker called neurofilament light change. And this is a blood test being studied to help monitor nerve injury. It's a good example of how we can keep ourselves up to date as a patient about the MS field advancement. Another great nonprofit resources we're going to hear more in detail about them is Can Do MS. They offer educational webinar on topics like fatigue, exercise, brain health, nutrition, emotional well-being. They also provide coaching programs and recorded exercise programs. And I love that about this website. Resources like this gives patient tools, support that they need. And you see they have webinars, coaching, many other different resources. Sometimes we don't have the time or energy to read long articles or attend webinars, especially when dealing with fatigue, vision issue, or difficulty concentrating. And so in those situations, podcasts can be a great way to stay informed while cooking, let's say while driving, or doing daily activities. And one podcast I often recommend is Real Talk MS. It provides weekly updates on MS research, treatment, and it explained in a very clear and easy to understand way. Another useful resource for patients interested in research is clinicaltrial.gov. It's a public database where clinical studies around the world are listed, and a patient can search for MS-related trial where they live. For example, here you can put multiple sclerosis and put Texas, and all the studies that are available for MS comes up, and you can even check and see which studies get participants if you are interested to be a part of that. In addition to national organization and online resources, I always encourage my patients to explore programs available locally. Many neurology clinics, MS especially specialty center, offer seminars, workshops, webinars, and support groups. And I have an example here. Brain Health Masterclass for Multiple Sclerosis is Rush University in collaboration with Brain Health Center of Rockies offers a Brain Health Masterclass for MS. It's a 6-session virtual class led by Dr. Augusto Miravalli and Miss Kathy Kiefer. It focuses on brain health in MS, including lifestyle strategies, exercises, wellness, and cognitive health. And I think programs like this give patients practical tools to help maintain brain health while living with MS. Emotional support and community connections are very important aspect of MS management. And here I brought an example of a study published in Journal of Neurology of where more than 180 patients with MS completed a comprehensive evaluation that looked at mental health, fatigue, quality of life, cognition, and physical abilities. And interestingly, it shows that they found people who reported having stronger social support report better mental health, better quality of life, better perceived cognition, and less fatigue. And this tells us how much the social support is important for patients with MS. So support groups, how to find them. If you're looking for support groups, 2 good places to start are websites of National MS Society. And sometimes speaking with someone who is going through a similar experience, like has MS, is very powerful form of support. I have here National MS Society support group and program and MS focused community groups. If you are looking to find a mental health counselor, the best way to start is by asking your neurologist or healthcare team for recommendation of a counselor or psychiatrist who lives close to you. However, there are also several organizations that can help patients find these resources like MSSA helpline, Can Do MS mental health resources, National MS Society emotional support, and Can Do MS coaching support, MSAA emotional health resources. So in summary, having reliable education help patients understand their disease and make informed decisions. Emotional support, community connection make a big difference in well-being. And organizations like the ones we discussed today provide guidance and resources beyond the clinic. Thanks again for giving me the opportunity to share this with everyone.
Dr. Khosravi, I think you gave us a really comprehensive overview of the excellent resources that are available. And thank goodness that is the case, that patients can feel secure in knowing that there is just a tremendous amount of support available to them. And I oftentimes think that the first layer of communication should be with the neurologist, right? They get that diagnosis, and then a patient walks out the door and feels rather overwhelmed and can be quite frightening. So I think it's really wonderful that you provide all of those resources and make patients aware of what is available outside of your clinic door. So thank you for giving us that really wonderful overview. Hopefully, all neurologists are doing something very similar and making their patients aware of what wonderful resources there are. So thank you for your work and thank you for providing this oversight. Well, I know we had a chance to hear from Alexis on MSAA to start us off. I do want to make sure we have plenty of time to also hear from Rosalind Kalb on Can Do MS, and then Margaret and Elisa from the National MS Society as well. So Roz, if you could potentially provide us with an overview of all the incredible work you're doing there at Can Do MS.
Sure. So hold on.
And while we have a split second, there are a few questions that have come in, and I'll make sure that we address some of those perhaps at the end. Alexis, there is one. There you go. I see you're typing. Fantastic. That's specific for MSAA.
Once again, I'm struggling here.
Not a problem at all.
Well, it is a problem because I want to get to the share while this is open.
There was a question that came through earlier that had to do about communicating with when you get you're newly diagnosed and how to communicate with your children. But I could understand how that might be a difficult conversation. So if any of you might want to address that while we wait for Roz to bring up her slides, I think that's an important area to discuss. Communication with your loved ones of a diagnosis. Anyone who
I'm so
wanted
sorry.
I cheated a little bit and I answered the person who sent the question in the chat too, just said hi and provided a few of MSAA's resources. We have a roadmap for the newly diagnosed, which is an interactive toolkit. And then we also have It's a Generational thing, which based on the ages shared, it might be aimed towards folks that are a little bit younger, but it's super helpful and nice high level overview. So I shared those two resources in the chat too to start.
Fantastic.
Can you go ahead and switch the order and I will talk last? I'm
Yep.
not sure why this isn't happening.
No problem. Margaret and Elisa, would you like to go next then and give us an overview of the National MS Society? You folks always have a lot going on as well.
Sure. We can dive in. Welcome. Thank you for having us. My name is Margaret Sheridan. I'm the director for community events. I'm joined by my colleague Elisa, and I'll be pivoting a little bit to her in just a moment. But yeah, we're really excited and honored to be here. So with the National MS Society, similar to MSAA and all the wonderful resources shared earlier, we are really actively working on advancing our mission and trying to create programs, resources, services that support all folks affected by MS. Our vision is a world free of MS, and I know we're going to get there. And so I'm going to turn it over to Elisa to share a little bit about our resources, and then I'll talk more about our events and how social support is really important and where we can take action here. So Elisa, I'll turn it over to you for your slide.
Thank you so much. And I want to thank Alexis. You did such a great job. And I want to thank Dr. Kasavri for the great mention of our Navigator program. That's our big promotion, and you did it so nicely. I truly appreciate that. So, my name is Elisa Schwamberg. I am the manager of healthcare engagement for the Western part of the United States, so including Colorado. I work with providers, nurses, PT, OT, anyone that works with people living with MS. And so we have multiple resources as well. And for healthcare professionals, we have MS information. We're doing a big outreach to primary care doctors because we feel like they're sometimes the front line. So we have a program we're working on right now, Early Signs and Symptoms. We have diagnosing MS and managing and treating MS. We have a lot of professional education. We have our ECHO MS program. We have our current topics webinar, case calls, and CHE e-learning. And for patients, most importantly, our MS Navigator program, we connect people to information, resources, and support needed to move their lives forward. Everyone, when they call in, will be assigned a case manager so that every time you call, you don't have to tell your story all over again to someone else. You're assigned a person as long as you're in the program. And we do a similar work of what MSAA does in just helping people, especially people newly diagnosed. I think that's key. We have a lot of educational programs for our patients. We have information for newly diagnosed. We have a program called New to MS, and a provider is on speaking about MS. We usually have a patient advocate on there as well, and people can ask multiple questions about what they can expect living with MS. We have a lot of educational programs for managing MS, including DMTs and symptom management. We have our Ask an MS Expert with John Strum. We have, again, our New to MS programs. And for support, we have peer-to-peer support groups and our MS Friends program. And for more information, you can scan the QR code that we have listed, and it'll give all of our resources and information.
Thank you. I'll turn it over to some of our events that we have. We have three buckets of events. We have community events, endurance events, and signature events. And this is across the country, though I'll speak to the Colorado, Wyoming chapter, just because that's where we're housed. And we have a lot going on. There's over 170 Walk a Mess events starting right now. The first one was last weekend, and they'll go all the way through June. So we have a lot happening, a lot of opportunity to get involved and engage with your community. And so Walk MS, is our first type of event under our community events. This is really, our leadership calls it like the front door, the front porch of the organization. Regarding the question about talking with your children regarding a new diagnosis, we actually have a place at every event called the center. And that's where all of our resources, all of our information is distributed out. We even have a kids coloring book that helps kind of as they color navigate through the journey as well. And so we really try to provide a breadth and depth of resources and knowledge here in the center. We also do a ceremony at our walk events, and we honor every year someone living with MS. So our events taking place are listed here on the slide in our chapter. I want to shout out Brain Health for being at the Windsor Walk on May 9th. And so you can stop by the tent. We do try to bring in local businesses and sponsors that are relevant and available and willing to support. And so shout out to Brain Health for being there. Nira, I see you too. And so definitely really excited for just engaging with our local businesses, our local companies, our local neuro clinics, mobility devices, and to have that in celebration for our walk events. So it's really inspiring. They range in size from a couple hundred people to several thousand. And so across the country, you can definitely engage. These are open and free events that we have for WALK, though fundraising really drives that critical research necessary to find that cure. So really exciting for our WALK events. We also have for our community event, if you're an adventurous hiker, we have a hike event. It's the only hike event in the country. It's taking place in July, at the end of July. This event is really, we have a variety of trails. We have a fully accessible route for our folks, and then we also have ranging in difficulties. We have a gondola that takes you all the way to the top as well. So you can always take that as an option. But it's just a wonderful weekend event, brings together community and unique environment to join in your fellow hikers here. So this one does have a fundraising minimum, but really just encouraging that support for our resources, for our advocacy, for our research, to really fund that forward. And so we have a hike event as well. If you are interested in our cycling style events and getting involved with that community or finding a social group to get you outdoors, our Bike MS event is one of our largest. I think the peer-to-peer forum just ranked it as one of the top 10 largest groups. So really excited for our Bike MS events. It's a wonderful way to come together and to meet other people. We even have Living with MS riders, which is a special jersey as well. And so you can really grow together. They have a variety of routes ranging again in difficulty. So you can do the whole century ride if you're interested, but this is just a really fun weekend. You build your community. You be a first time rookie rider, or you keep doing it for 20 years. It's a wonderful way to celebrate and be together. They party at the end of day one too. So they love to come together for this ride. And there's also rides beyond Colorado, and you just highlighted our chapters here as well. We also have signature events. And so we have a luncheon and we have a dinner. Again, those are across the country. Ones here in our chapter are based in Salt Lake City. So if you're local, definitely recommend. It's coming up in a couple weeks here. But this is a really inspiring way to come together in a formal way and meet other folks. They do a model show honoring people living with MS, and they have silent auctions and just ways to get to know other people supporting in this way. So our Dinner of Champions is at the end of September, and they can spread out throughout the year. But these are really fun. You dress up and really just come in to show your support and to meet your fellow folks in your community that are all working towards the same cause here. So if you're interested in building out that support or building out that connection, engaging in your community, you're welcome to build a team. Again, walk is free. There's no fundraising minimums. You can just bring your friends and family, your neighbors, your coworkers, whoever it might be, to just show up and see how people come together so powerfully in a single day. So love to talk with you about finding something local wherever you're based in the States. And if you want also to make a donation, it does fund our critical research. We fund every major breakthrough the National Society has, since we've put over $1.1 billion into research alone. And we've also funded advocacy. So the restoring of the $15 million in federal funding, we really had our advocates push for that and support. We also fund our resources like our MS Navigators that Elisa shared earlier, and several services we have throughout the country. So you can always get involved, or you could volunteer, donate your time. That's always another option as well. So I wanted to just plug in a few QR codes, some resources to find your local events today. So I'll leave this up for just a second, but you can find your walks, your hike, your bike rides nearby to really grow in that. And all of our resources are available on these websites as you click through. We have that available, but happy to answer any questions or get you in contact with your local director in the area. But this is my email and Elisa's, and feel free to reach out anytime. But thank you again for having us, Nira, and for putting this together, Kathy. Really appreciate it.
Thank you so much.
Well, thank you. And I'm always inspired with National MS Society as well. Some of the large scale events like the Walk MS really does bring together a large group of patients at one time. And it's such a great spirit to see everybody out and about and actively involved. Dr. Miravale, he's done the Bike MS event out here in Colorado and is always really inspired by that event as well. I have not participated in the Hike MS yet, and I will need to make sure I do that at some point. So thank you for putting those dates out there and making everyone aware of your upcoming events for this year. I want to make sure we allow some time for Roz to also go through her presentation. And Roz, if you're having any difficulties, I do have your PowerPoint that I can bring up as well. So if you if I want to give it a go. Otherwise,
Are you
we're
seeing it
good.
now?
Yes, we're good.
So I'm really sorry about that, everybody. The only thing that's important about this first slide is the 40 years in MS. And the reason, well, two reasons now, listening to what everybody has shared tonight, I'm awestruck at how much has happened in the MS world in the years that I've been working here. It was not like this at all 40 years ago, prior to disease modifying therapies, prior to all of the amazing programs and activities that are available. But when I first started as a young psychologist at the MS Center, one of the patients that I met coming to our comprehensive care center was Jimmy Huga. And Jimmy founded Can Do MS after he won his bronze medal in downhill skiing, the first American to medal at the Olympics. And he was diagnosed shortly thereafter and was told by neurologists at the time that he needed to give up his activities, turn himself into an MS patient, and basically rest. He became very depressed as he tried to follow their recommendations, but decided that this just wasn't for him. He'd been an athlete his whole life. This was not his way of living or his way of managing his body. And so he decided that he was going to continue to be very physically active, engage in exercise, eat a healthy diet, get plenty of sleep, surround himself by supportive people. And lo and behold, he felt better. It didn't cure his MS, of course, but he did feel healthier and better. And so he started a program for others living with MS. And at the time he started them, they were all in-person programs in Colorado. People got together with a multidisciplinary team of healthcare professionals for 5 days to learn, to share, to be evaluated, to get clinical recommendations, to bond, and to care for one another. With COVID, of course, a lot of that had to change. And those in-person programs had to be put on hold for quite a while. In the meantime, Jimmy had passed away, although he skied until the week he died, because his philosophy was you focus on what you can do, not on what you can't. And so he continued to find ways to adapt and continue to do what he loved. And yes, he was absolutely as cute as he looks in this slide. So today, what Can Do MS is all about is that health and wellness focus that Jimmy brought to his own MS care, plus his Can Do philosophy, which is about either finding new ways to do the things that you love and have already done, or finding new activities to enjoy, whatever they may be. We also focus on an interactive coaching model, all of which is really focused on improving quality of life for the entire family. Jimmy started believing that the care of care partners was just as important as the care of people living with MS. So every Can Do program is as much focused on the care partner as it is on the person living with MS. I think what makes us unique is that every single program we do, and we'll talk about those in a moment, are multidisciplinary in focus. So whether it's a program about a particular symptom, or about staying active or having a healthy diet, it is always a multidisciplinary team of clinicians working with people with MS, so that, let's say diet is a good example. You have a registered dietitian who may be talking about what the recommendations are and what we know about diet for a person with MS. But then there's a psychologist or other mental health professional talking about emotional eating or some of the feelings that we have around eating or that drives our eating, plus the cultural pressures that can sometimes affect people's eating habits. And then we may have a rehab person talking about how combining exercise and physical activity with a healthy diet is also a very good way to stay healthy. So always multidisciplinary, always helping people to focus on goals that are attainable. not pie in the sky, I'm going to lose 50 pounds in the next 6 months, but what is a goal that you can chip away at a bit at a time, experience success while working on any health and wellness goal that's important to you? And part of that for us is meeting people where they are, not us telling them what they need to do or should do or have to do. It's what is it that you want to change in your life? What steps forward do you want to take? And how can we help you achieve that goal? And also a wide variety of ways to connect in some of the programs that I'm going to talk about. Each month, we have a webinar on Webinar Wednesday, and it starts the month focusing on a particular topic. Last year, we did a different symptom every month, but other times we'll talk about things like getting healthy sleep, finding a diet that works for you, staying active so that you continue to engage in exercise and physical activity at whatever level you're able to do it. So the webinar starts the month, and we make those as interactive as possible. So right from the get-go, people feel like they're not being talked at, but talked with. Then we have a monthly virtual jumpstart program. And in this workshop, we focus on that monthly topic, but we use a very short introduction at the beginning to sort of level set for those people who weren't at the webinar. And then we break into our small discussion groups, which is really the hallmark of what we do. We get people into small discussion groups with clinicians where they can address certain questions or topics, get input from each other, because what people with MS have told us is that they love learning from clinicians, but they love learning from each other more. They want the tips, the insights, the tools, the strategies that have worked for other people. They want to take them home and try. And oh, by the way, while they're exchanging that information, they are connecting. They are feeling very much a part of each other's lives and well-being. We also have your questions answered every quarter so that people can just come and ask whatever questions of a multidisciplinary team that they've been saving up or that they have in mind. And these have been extremely popular activities. Our coaching programs, I think, have become our centerpiece because it is within the coaching sessions that people find that community most comprehensively. A coaching program can last either 4 to 6 weeks, consecutive Wednesdays, for example, for 4 weeks or 6 weeks. The one that's happening right now is about sleep. And hundreds of people have registered for this coaching program because it turns out that nobody is getting great sleep. People living with MS or their care partners have all kinds of reasons why their sleep is disrupted. And so they've come together with this multidisciplinary team to learn strategies for improving their sleep. But we've also had coaching around cognitive issues, mood issues, relationship, how to stay active, that sort of thing. Free from Falls, which was a program that originated at the National MS Society when I was there, and we've now done 3 years of a Reduce Your Risk of Falling program, again, multi-week, where people have learned strategies for maintaining their safety. So this year, Reclaiming Your Rest has been our first coaching series of the year, but you can register for Eating Well with MS, which is going to happen starting in June. And then Managing Fatigue was the last coaching series of this year, which will start in September. We've also been able to, since COVID, go back to having community programs. These are the programs on the calendar this year, but what's unique about these is that we go to parts of the country where there are comprehensive care centers, and we partner with the clinicians at those centers. So if we come to the city where you live And we work with the Comprehensive Care Center there. You'll have some representatives from Can Do, but also the clinicians you love right there at your center. And we work together to present a program, and our curriculum this year is all about brain health and all the ways that you can protect and preserve your brain health, your cognitive health. So I hope that I will get to see some of you at these programs. We also have meetups, and this has been another way for different parts of the community to get together and bond and form relationships across the country. So care partner meetups have been a particular joy of mine. I've probably spent more time with care partners than anybody in the MS world, because at the in-person programs, I used to meet with care partners 4 or 5 times over the 5-day program for 90 minutes. And care partners get to experience what it's like to sit in a room where they just focus on their own feelings, their own needs, ask whatever questions are on their minds. And we do those quarterly. And the same people show up every time, plus some newcomers each time. We have a Black community series where the Black community gets to meet up and share and talk. This year, we've started newly diagnosed meetups wanting to engage people who are still very active and busy with their new diagnosis and don't have time to go to a lot of programs, but still want to bond and meet others who are having similar experiences. And then you saw a brief picture, our MS Moves meetups, where you can get together with other people who have been doing our online exercise program and talk about what your challenges are with setting goals or being consistent with your physical activity. So these meetups have been very successful. And I can tell you that I was thinking about the kinds of feedback we get, and there are really 4 key things that we hear from people who participate in these programs: that they feel connected and less isolated. That really is the most important thing that all of our organizations are doing for people. They also feel informed, not just about the disease itself, but about the resources and about the tools that are out there. So they go away with a tool chest that helps them feel more equipped. They feel validated. We hear that word a lot. My feelings, my questions, my worries are real, and somebody is hearing them and helping me manage all of that. And lastly, they talk about feeling supported by people who get it. And I'm sure all of you, my fellow presenters, hear that at your organizations, this notion that others get it. When you're feeling isolated, that's just such a high priority. So I'm proud to be part of this group. I'm proud to be on this panel tonight because everybody's been doing such amazing work in MS, and I appreciate the opportunity to be part of this. And I just encourage you to come to the Can Do website, which is cando-ms.org, and see all of the different kinds of programs. You can register very easily for all of them, and we would love to have you join our community. Thanks very much, Kathy, and appreciate being part of this.
Thank you so much, Dr. Rosalind. But it's one thing that I love about Can Do MS is that it's an organization really focused on breaking down the silos and having that multidisciplinary approach, which I think is really critical. And a little bit of having a focus on the personal aspect, this personal interaction. Each of these organizations that we were able to have speak tonight, all of you do such wonderful work. Each of you have a unique area within this MS community, and it's so incredible to just have you all together and really lay out for the MS community the things that you're doing. It's just lovely to have a wealth of opportunities to get involved, and for the MS community not to feel patients to feel lonely. So I really appreciate you highlighting the work that you're doing. Dr. Khosravi, thank you so much for being with us tonight and sharing from your side, from the neurologist side as well, and giving us a very high level of resources out there for patients. This has been really wonderful, and it's so great to honor to honor MS Awareness Month. And I know I said NMOSD for those folks who are wondering what that is. It's neuromyelitis optica spectrum disorder, is oftentimes historically been confused as MS. So both fall under the month of March. So
Kathy, can I
yes,
just mention that CanDo is partnering with SRNA, the Siegel Rare Neuroimmune Association, and we are going to be doing a coaching program this year again for the third year. So if any of the audience is living with a rare neuroimmune disease and knows about SRNA, you can register for that 4-week coaching program, which is a collaboration between CanDo and SRNA.
fantastic. I might hit you up for more information on that to disseminate that. Well, again, thank you all. I know we're a little bit over time today.
My
I
fault.
appreciate. No, it's not your fault at all. I think this was all wonderful information that needed to be shared. So I really, truly appreciate you all being here this evening, and thank you for the wonderful work that you're doing. Hope you all have a great evening, and keep up the good work.
Thank you so much.
You.
Thank you.